My name is Jessica Van Huysen, and I'm going to talk to you about vitamin D and type 1 diabetes mellitus. Vitamin D, fat-soluble vitamin that has two forms, vitamin D2, which is ergocalciferol, and vitamin D3, which is cholecalciferol. Less than 5% of vitamin D comes from dietary sources such as fatty fish, tuna, oysters, egg yolks, and fortified foods. It is produced mainly from skin exposure to ultraviolet B rays. Deficiency results in rickets in children. It's a failure of growing bones to mineralize. In adults, reduced calcium and phosphate absorption, leading to osteomalacia. Toxicity is quite rare for vitamin D. When it does occur, it's usually due to oversupplementation and leads to hypercalcemia. Deficiency is classified as serum 25-hydroxy vitamin D levels lower than 30 nanograms per milliliter, and optimum levels are between 30 and 80 nanograms per milliliter. Common deficiency is known worldwide in all age groups. Vitamin D is associated with autoimmune diseases, calcium homeostasis, immunomodulatory effects, and insulin secretion. A little bit about type 1 diabetes. Type 1 diabetes is a chronic autoimmune disease. It is still poorly understood. They believe genetics causes a predisposition. However, environmental triggers are necessary for type 1 diabetes onset. It's characterized by hyperglycemia, which is either caused by defects in insulin action, insulin secretion, or both. It's a significant global health problem, and onset is more common in childhood. So what's up with vitamin D and type 1 diabetes? Vitamin D is a common deficiency among type 1 diabetes patients. An association was found between low UVB irradiance and high incidence rates of type 1 diabetes. But why? Vitamin D is directly and indirectly related to insulin secretion. Directly, it is connected through specific receptors on beta pancreatic cells. Indirectly, it is connected to pancreatic tissue having vitamin D-dependent calcium-binding proteins mediating the intracellular and extracellular calcium influx in beta cells. The active form of vitamin D has immunomodulatory effects on the cells of the immune system. Deficiency interferes with normal immune function due to its connection with the immune system and the cells of the immune system. Type 1 diabetes is a life-threatening endocrine disorder in children and adolescents worldwide. Type 1 diabetes patients have an added complication of increased risk of fragility fractures associated with bone mineral density. There is still debate on whether vitamin D deficiency is caused by the autoimmune disease, type 1 diabetes, or if it is a triggering factor for the onset of the disease. So let's get researching and figure this out.